Welcome! My OK Plan is here to show you how to get an estimate of your discounts for marketplace health insurance plans on HealthCare.gov. You can get an estimate on your own in under 10 minutes without having to give your name or contact information. The information in this video applies to individuals who will file their next tax return as a single adult. Please see our other videos for couples or for people with children at myokplan.org. The information in this video applies to individuals who will file their next tax return as a single adult. This may also apply to unmarried couples. If each person files their own separate one-person tax return, this typically means two separate one-person marketplace applications. If you have children or you are married, please see our other videos on finding discount estimates for those situations. Note, this estimator does not have a checkbox for American Indian and Alaska Native tribal members. To see correct plans for tribal members, please complete a full application on HealthCare.gov. You will find your discount estimate on HealthCare.gov/C plans. That's health, HEALTH, care, CARE, .gov/CSEE dash plans, PLANS. Make sure to use .gov to avoid scams. The next slides will show you how to get your estimate. This website does not ask for your name or any contact information. It does not save your information, and you can redo your information at any time to get a new estimate of your discounts. Navigate to healthcare.gov/C plans to begin. Marketplace discounts are health plan premium tax credits that you can use to lower your monthly premium bill. Again, this website provides a financial help estimate for discounts based on income, tax household size, and other information that we will tell you about in the coming slides. This is a financial help estimate. That is why questions are about income and tax household size to calculate your discounts. To calculate your discount, here's the info that's needed. Total income for everyone on a tax return with you, how many people are on your next tax return, zip code or county, and age. Other rules and qualifications apply to receive discounts. After you see your discount estimate, you can complete a full application at healthcare.gov. Now, let's go through the screens that will get you your discount estimate. Reminder, you will not have to share your name or contact information to get your estimate. On the first screen at healthcare.gov/C plans, find the box labeled Enter your zip code and choose your location. Enter your zip code, then choose your county. Wondering why the website asks for this information? There are different plans and prices in different counties in Oklahoma. Make sure to enter the zip code and county of where you live, not where you get mail. However, a P.O. box or different mailing address can be entered in the full application. Once you've entered your information, click on the green Continue button. You've already entered your zip code, so we are now on step 2 in the process. Click the green Start button to continue. You will continue to click green buttons as you navigate through the website. At the bottom of the screen, you will see a blue box that gives the option to not answer questions. Clicking the button in this blue box means you will only see full-price health plans. To see your discounts, please continue to use the green buttons to answer questions that are necessary to calculate your discounts. This information is optional. Just click on Skip to continue. It asks about old health plans, so you can just hit Skip. Now we're looking at the first question to help calculate your discounts. Who is in your household? Why do they ask this? Household size and income determine financial discounts. For example, a 3-person household with income of $30,000 will be eligible for more discounts than a 1-person household with the same income. If you are a single adult, click Just You since it is just you on your tax return, then click on the green Continue button. Next, you will see this screen titled Tell Us About You. Fill in your age because insurance premium prices are based on each person's age. Sex. This does not affect the cost of insurance. There is a pregnancy question we will review in a few moments since a pregnant person may be eligible for Sooner Care. Next, let's look at the 5 boxes at the bottom of the screen. Check any box that applies to you. Box 1 asks about your eligibility for other health plans. There are 3 categories: job plans, Medicare, and Medicaid or Sooner Care. If you are offered a health plan by your job or your spouse's job, click the box. If that health plan from a job seems too costly for you or others in your household, to calculate your eligibility for discounts, complete a full application at HealthCare.gov. If you are eligible for Medicare, click this box. Sooner Care is Oklahoma Medicaid or CHIP. Don't click this box if you have Sooner Care right now. This website will calculate if children or adults may be eligible for Sooner Care. Box 2 asks if you are a legal parent or guardian of a child under 19. Why? To check for Sooner Care eligibility for the adult parent. Box 3 asks if you are pregnant. Why? To check for eligibility for Sooner Care pregnancy coverage. Box 4 asks if you are a tobacco user, specifically if you have used tobacco products 4 or more times per week on average during the past 6 months, not including ceremonial uses. Why? There are higher insurance rates for tobacco users. Or click on box 5 for none of the above and hit the green Continue button. This screen asks you to confirm your household members. It shows the information you entered and allows you to edit and make changes if needed. Click the green Confirm button to continue. The next section will ask about your income to calculate discounts, since your discounts are calculated based on both income and household size on your next tax return. When estimating income, use the total income for everyone on your next tax return. Enter your gross income before any deductions as the total income for the year. If needed, there's help for estimating your income coming up. Are you self-employed or an independent contractor? To get your discount estimate, use your net income after subtracting business expenses. After seeing your discount, to get more information, complete a full application at HealthCare.gov. To calculate your discounts, this screen asks, what do you think your household income will be for the year? Enter your total income for the year. Total income includes money from jobs, some investments, rents, and royalties, as well as Social Security retirement or disability payments, and some tribal per capita payments. For more hints about income, click the blue link that says See How to Estimate. The next number you will see is your estimated discount. Important note, this is not the cost of a health plan. It's your estimated discount. When you look at the list of plan options, the discount will be subtracted from the monthly premium. To see the list of marketplace plans available in your area, click the green View Plans button. Marketplace offers many health plans, so know that you have options. There are dozens of plans available from different insurance companies. Keep scrolling through your list to see all of your options. All plans cover the same list of diseases and injuries, behavioral health, and pre-existing conditions. Here's some more background on health insurance pricing. As you scroll through all your plan choices, you'll see plans with low premiums after subtracting your tax credit discount. These plans will likely have a high deductible. You'll also see plans with a higher monthly premium, and these will likely have lower deductibles. Prices vary by deductible. Like car insurance, a higher deductible means a lower monthly premium. The difference is that car and home insurance set a maximum amount that the insurance company will pay, while health insurance sets a maximum that you will pay, even if the health costs are much higher. Even with a high deductible, most health plans offer discounts the first day before the deductible is met. You get the insurance company discounted rate on office visits, prescriptions, procedures, and other services. For example, your first drug prescription is usually at the listed discount, not full price. With some plans, you pay a set dollar amount, referred to as a copay. With other plans, you pay a percentage of the bill, referred to as coinsurance. Prices vary by bronze, silver, and gold levels, but what is covered does not change. All plans have the same list of conditions, diseases, procedures, prescription drugs, free preventative services, and vaccinations. The metal level, bronze, silver, or gold, is how you split costs with the insurance company. On average, bronze is 60/40, meaning you pay about 40% of the costs, so the premium may be the lowest. Silver is 70/30, meaning you pay about 30% of the costs, so the premium is also low. Gold is 80/20, meaning you pay about 20% of costs and the insurance company pays 80%. Prices vary by insurance company and their in network list of doctors, hospitals, and options for services in the plan. You can enter your preferred doctors and hospitals to see the differences between plans. First, click on the green Add Filters button at the top of the page. Click the blue Add Providers button to search and add your doctor or hospital's name. You can add multiple hospitals to compare your options. Click the blue Add Drugs button to add the names of any prescription drugs that you use regularly. Now we'll show you how to add your preferred doctors and hospitals. Enter the name of your doctor, healthcare provider, or healthcare facility. You can enter multiple doctors, providers, or hospitals to compare plans. Enter the name of any prescription drug that you use regularly. This is optional. You can enter multiple prescription names to compare plans. Using these filters will show you plan differences on Marketplace. Here are a few examples of different hospitals in different plans. Keep scrolling through your list of plans to compare your options. This is just an example. Enter your own choices of hospitals and providers. Marketplace will show you plan details. Click on View Plan Details for a full list of benefits, limits, and exclusions. Click on Plan Documents to see the full information for your plan, including summary of benefits, plan brochure, provider directory, list of covered drugs, costs for medical care, and prescription drug coverage. Always remember, you make the decisions. Different people in your household can get different plans, and someone can decide to not get a plan, while others in the household do get a plan. When you want full information or are ready to enroll in a Marketplace health plan, use the website HealthCare.gov. Look for the box that says Apply for Coverage or Log In. That will start you on the full application that will calculate your discounts and let you enroll in the plan you choose if you are eligible. To find more health insurance resources for Oklahomans or to see versions of this video for couples or children, visit myokplan.org. If you have difficulty finding or enrolling in a Marketplace plan, please complete the contact form on myokplan.org to request the assistance of a local enrollment specialist. By the way, our service is free. This video is supported by the Centers for Medicare and Medicaid Services, CMS, of the U.S. Department of Health and Human Services, HHS, as part of a financial assistance award totaling $3,100,000 with 100% funded by CMS HHS. The contents are those of the authors and do not necessarily represent the official views of nor an endorsement by CMS HHS or the U.S. government.